Support for Carolina Business Review provided by Grant Thornton. Operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries.
Depending on what source you may be citing, healthcare spending as a percent of this national GDP in our country is about 18%. That's approximately $3.1 trillion, which roughly equals the total output for both Russia and Spain combined. Is there any wonder this is such an acute debate in this country? Welcome back, and thank you for supporting the most widely watched source for Carolina business and public policy. It may seem arcane and hard to follow, and that's because it is, but the current healthcare landscape in the Carolinas is very dynamic, and our decisions now will have far-reaching consequences. Later on, Carolina's healthcare boss, Michael Tarwater, is back, but we will get started with our expert panel in just a moment.
Major funding also by Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. The Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. And by Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. On this edition of Carolina Business Review, Dr. Linda Millsaps of the North Carolina Center for Public Policy Research, Frank Hefner, Professor of Economics, College of Charleston, and special guest Michael Tarwater, CEO of Carolina's healthcare system. Now, here's Chris William.
Thank you for watching our program. Dr. Millsaps, Dr. Hefner, welcome to the program. Good to have you.
Thank you. Good to be here.
Thank you. Linda, yes. Let's start with Medicaid. Let's start with Governor McCrory in North Carolina was making sounds that in fact, he said he was seriously considering what plan North Carolina could adopt that would allow taking federal monies for Medicaid. And South Carolina is not exempt from this. South Carolina doesn't take the Medicaid dollars either. But so I guess a bigger question is here, Linda, what kind of dialogue do we need to be having that is going to convene around Medicaid funding that is more reasonable dialogue?
That is more reasonable dialogue? Well, that's kind of a loaded question, Chris. But I think maybe what needs to happen is first of all, some of the things that the governor has already done. I've been around state government for more than a decade, and during that entire time, almost every year, the Medicaid budget came in almost $500 million over what it was scheduled to be. This administration has done a pretty good job of trying to rein that in and really understand what those numbers mean. So that was kind of one of the first hurdles, and you might recall that was why Governor McCrory said initially he was very concerned about taking the federal Medicaid money. So that's one of the things. But more importantly than that is to really try to get the right folks in the room with good information, good facts, but with a larger focus. And so that's something at the center that we're going to be looking at, is to really get people who are in the know, like some of the folks on your show today, to really look at what is the true information, and not necessarily coming in with a particular set of we want to have outcome X or outcome Y, but to try to get people to move away from those predetermined positions. And possibly part of the way to do that is to talk about a much larger issue of not so much just Medicaid, but healthcare delivery in North Carolina, and by association, South Carolina. What is it that we really want our healthcare delivery system to look like, whether it's publicly funded, publicly supported, or completely private? and then kind of walk back from that. I think that will be very, very important in trying to move this discussion forward.
Frank, Linda very eloquently laid out the plan for a better way to debate.
It was fantastic. Who could disagree?
You believed it?
Well, no, I believed it, and who could disagree? I mean, clearly that's what needs to be done. But if you look at some of the not mandates, but that's the problem. Let's use that word, mandate, that you laid out on the table. It was fundamentally, yes, we need to discuss how much of it's going to be public-private partnerships, and then more importantly, how much of it's going to be federal versus state. And that's one of the biggest problems with, I think, the Medicaid debate right now, is that it's a federal program that doesn't fully compensate, doesn't fully pay. So it ends up being what some people are worried about as an unfunded mandate. So you accept the federal money,
right?
You got federal strings. And the biggest string then is you have to pony up state money to match it. And then the question is, how big will this become? And more importantly, we have something in economics called time inconsistency. Basically, what that refers to is, you're telling me this is what you plan on doing now, but can I believe that's what you're going to do in 5 years? And if the federal government says this is what we're going to deliver now, it's not clear that the state can count on that.
Which is one of the big issues that comes up in the debate around health care, and that's the uncertainty, not just about mandates, but what ACA will do in the long term, how more of it will unfold. Is there any way to mitigate the uncertainty of this dialogue? And I'm asking that, Linda.
Well, one of the possibilities for the state to mitigate some of that uncertainty is to put forward a waiver. In 2017, the states are going to have an opportunity to move forward, and similar to how states can do now around Medicaid, they can put forward, this is our plan, and go to the federal government and say, we think this is the better way to do, in this instance, Medicaid expansion. Going forward, they can also do that related to the Affordable Care Act. And so again, that gets to the much larger issue of what healthcare delivery should look like in North Carolina or South Carolina. Right now, Vermont is the only state that has come out and said, we are absolutely going to put in a waiver. And at this point, kind of to your point, there's a lot of regulations that haven't been written, but the ones that are out there now essentially say you have to provide basically the same level of service to about the same number of people. And that creates a very, very broad brush, a really broad opportunity to, again, look at what are some things that we can do. Related to that, I think there's a lot of smaller pieces that we can start focusing on before then. A lot of ways we kind of get in our own way of trying to deliver good health service. For instance, in talking to some of the health administrators across the state, the issue of just having one set of electronic medical records, no matter which health system you went to, would do a lot to reduce their cost. There's some regulation that makes that challenging, even if they wanted to do that. So how can we address those things?
Not to interrupt you, Dr. Millsaps, we're going to have, I want to carve out a couple minutes here before we bring our guests on, just to take us this side road. South Carolina had an excellent year in economic development last year. A lot of momentum. Would you expect 2015 is going to be same, better?
Well, the general rule we're having right now is if you liked last year, you're really going to like this year. And given what's happened in the national economy in terms of job growth and the, finally, wage pressure upward, this is finally the labor market's acting like you would think it should act. I'm saying now 2015 is going to be even a lot better than what 2014 was like.
And just in time for a Fed rate increase, too. Right?
Yes, yes.
Linda, North Carolina is trying to find its mojo in economic development.
Right.
They seem to be going, Christopher Chung is the new exec over at Commerce. But how, what policy, and we've got about a minute, what policy do we need to be talking, they say public-private partnership is the way to go for economic development now in North Carolina. What do you say?
I think it has to do much more with what you deliver than how you deliver it.
What does that mean?
North Carolina turns out to be 23rd in the country in terms of innovation, which puts us pretty much in the middle. And a lot of that has to do with a culture that we don't necessarily have anymore. We had a great culture that created all the success that we see at the Research Triangle Park and here in Charlotte. But we haven't done as good a job as trying to create a fertile ground for new innovation, new entrepreneurship. Our venture capital availability is fairly weak compared to other states. So there's a lot of things we could do about growing things from the ground up, independent of all the discussions about if incentives work or not. Generally speaking, jobs that you grow on your own tend to stay longer, and they tend to have much stronger long-term economic impact.
Okay, and just very quickly, is that the primary, should that be a primary role of the North Carolina Department of Commerce, or is there someone else in a lead to help this new resurgence that we need in innovation and thinking that way?
Well, my thought is that it probably needs to be a larger group of folks. It needs to be the Department of Commerce, also the new partnership folks, but there has to be some things that go out on the hinterlands too, places that aren't just Raleigh and Charlotte. So it needs to be a larger group that looks at that and really tries to think of a new way to bring a culture.
Guys, thank you. Stay with us. We're going to bring our guest on in just a second. Next week on this program, he is the relatively new chancellor at one of the UNC system schools. It is the University of North Carolina System's School of the Arts. Still call it what, I almost want to call it what it used to be. Lindsey Bierman will be here from UNCSA next week. And then in 2 weeks, last time he was on this program, he was mayor of Spartanburg. His name is Bill Barnett from Barnett and Son, widely thought of as a governor contender. About 4 years ago, decided to bow out of politics, still has a lot of influence in the state of South Carolina. Bill Barnett will be here in 2 weeks. You have most likely heard or argued all of the highlights of the health care debate. Does the ACA go too far? Does Obamacare go far enough? How do hospitals bill? Why does it cost more and have less flexibility, or does it? Or simply, how can the process be easier to understand? But the health care discussion is also so much more. Joining us again is one of this nation's and certainly North and South Carolina's largest healthcare system providers. We welcome Michael Tarwater back, Chief Executive of Carolina's healthcare system. Michael, welcome to the program again.
Thanks, Chris. Good to be here.
Michael, you know, as the largest player, Carolina's healthcare system has a unique role and a unique, I would say, responsibility to help model and frame this debate going on in healthcare. How do you see that?
I think it's absolutely true that the providers have to take a leadership role in, maybe even before the debate, the reform of the way healthcare is delivered. I mean, the ACA, I think, was, you know, politics aside, the ACA was a marker that said we can't keep doing this anymore. We have to change. We have to lower the cost curve, and in order to do that, we have to take a system that was built based on society's demand for the best, close by, latest, smartest, don't want to have to wait, don't care what it costs, to one where all those factors are still true, except now we care what it costs, and oh, by the way, we want the quality and the level of service to be higher. So in order to do that, you have to reform the way you deliver care. And you can't do that in Raleigh, and you can't do that in Washington. You have to do that where the care is delivered.
Do you get a sense that there is, congenial doesn't say it, civil doesn't really say it, but do you get a sense that there is the same approach at some of your competitors? Do you get the sense that you all want the same thing while being competitive?
You know, I think just like any other group on any other topic, there's a continuum. But I think most providers across the country understand that, and some are taking a lead position. I think Carolina's healthcare system is among those. But yeah, I think it's an undeniable truth. We have to change something, and changing the way we deliver the care, the way we do what we do, is, I think, the best way forward.
Linda?
I thought, I'm sorry, I'll jump in.
Or you can go for it.
Yeah, well, I'll just jump. Hi, I'm Linda.
How's that?
No, I think, you know, from my perspective as an economist, I think you almost, you know, hit the nail right on the head, basically. You listed a whole set of demands that the consumer has. And if you look at them, they're almost incompatible, especially given the way we're sort of doing healthcare payment schemes right now. I'll just make a general comment. If you want effective, inexpensive healthcare, just look at the military back in the old days when everyone stood in their skivvies, one long line. That's not what people want. So how do you address that problem, in that there's a huge demand for high-price services, but not a willingness to pay, I guess?
Yeah, well, the way we've addressed it so far is that those that can pay paid for those who couldn't. Okay. There's a cost shift that goes on. Right. Business and industry, and individual policyholders, but for the most part, businesses who are either self-funded or buy group products, pay more for what they get to subsidize those who either A, don't pay, or in the case of the federal government and Medicare and Medicaid, which is on average, I think, constitutes about 55% of payments to hospitals. Right. They pay less than the cost of delivering that care. So that's the formula. That's how it works today. And that was driven by that set of demands, basically, that society had. So we have to change the expectations of society. But at the same time, we have to be more efficient about what we do and how we do it.
Right.
So I guess
your turn.
My turn.
Yeah.
Thank you. So I guess related to that, and I think you have obviously very eloquently laid out exactly what the problem is. Our demands are very high, but we don't want to pay for it. And I think a lot of people would argue that's going on in several places in our society right now. So it's something we all have to deal with, related to all policy issues. So related to that, as someone who has to deal with this, what are some of your thoughts about how either state government and even local governments, I know you all have to deal a lot with county government, can be helpful in helping us as a society start to grapple with this issue? What are the things that are in your way? What are the things that if they could be changed just a little bit could help? And what are the big picture kind of things out there?
Well, I think one of the things you've, I think, talked about earlier before I arrived on the scene was Medicaid expansion. And again, as apolitical as I can possibly be, I think that the facts are that North Carolina and South Carolina providers have sent billions of dollars in payment cuts back to Washington. Taxpayers in those two states and about 20 others are paying higher taxes to fund the full idea behind the ACA. When the Supreme Court ruled that state expansions of Medicaid were optional, a big piece of that overall plan got stripped out. I understand the reasons why. But the money that we as citizens paid in taxes and that the provider communities gave up in terms of payment cuts still go to Washington, and they're now being used to subsidize health care for citizens of other states. There is also a tremendous cost on, I think, the state's economy, and by leaving that money on the table. So one of the things that the states can do is to you know, whatever political issues they are, if you can put those aside long enough to look at the business issues. We're talking about jobs, not just in healthcare. Estimated 2016 failure to expand will cost North Carolina 22,000 jobs. About half of those in healthcare and half outside in support industry. So there are a lot of things that governments can do. Slow down on the whole regulation thing. Let us digest what we have. There are a lot of good things going on, and but we have to have the time and the focus to be able to work on this.
So again, not to belabor the issue, Michael. So being apolitical, and sometimes the obvious question is the obvious choice is the right choice. Are the states, are North and South Carolina, if you just look at it by the numbers and nothing else, are we missing the opportunity to take the federal dollars, but taking politics out of it?
Yes.
Is it the right call to take the money?
Yeah, I think the right call is to take the money. It's money that we as citizens of North Carolina and providers in North Carolina, South Carolina, same thing, have sent to Washington. And the people that money was supposed to cover, they're still getting sick. They're still showing up. They're still needing care. It's not like they said, okay, well, we'll just hide out in the background over here until you figure this out. So the economic stimulus, the ability to cover people who do not now have coverage. And the thing that really cinches it for me, Chris, is we are paying for that again. Because when the people do get sick, they usually wait to get their care until it's at a much higher cost level. And then we, society, our states, pay, the corporations who pay the cost shift, pay for that. So we're paying for it now, and we've paid for it and left it on the table in Washington.
Do your counterparts at other healthcare systems, do they fall in line with that idea?
Yeah, they might not speak out as vocally as I do about it, but they do.
Yeah, no surprise.
Behind closed doors.
Yeah. Frank?
Well, I just, perfect example was the Transportation Administration, where we federally tax, but at one point, decades ago, it was if you didn't lower your speed limits to the federal mandate, you did not get the federal funds. And that's the problem with healthcare also. So in other words, if we don't comply, we're paying the taxes correct, and it is going to Washington. And so it's a nice game strategy to get everyone to jump on board, and it's a high cost to opt out.
It is.
But I think, on the other hand, there are a lot of people worried about the high cost of opting in.
Yeah.
And so that's the balance everyone has
Is there
to
a
deal with.
question in there somewhere?
No, it's just an observation.
I can't believe you don't have a question. Linda, go ahead.
Well, and I guess, mine might also be an observation, because it's interesting. We can't do that.
No observations,
No
guys,
observations.
questions.
Those
are the rules.
Those are the rules. Then I think it actually goes to, though, the issue of what is the impact of all of this for the business community. You mentioned what it means for your business. I would note, though, that you're a nonprofit, so you have different rules than businesses do. For instance, if someone shows up at McDonald's or Walmart and they don't have money, you don't have to serve them.
That's correct.
In your case, the federal government requires you to serve those people who show up in your emergency room. So that puts it on a different playing field than business. But what do business folks tell you when you talk to them about this issue? Do you feel like they are well informed on it, and how can others help them become more informed on what this means?
Well, I think the business, let's just use your example, okay? So the fellow leaves McDonald's without getting served, walks across the street, gets hit by a car, gets taken to the emergency room, gets treated, life saved. He can't pay for it, okay? Business is paying for that, okay? They're paying for it through the premiums they pay for their employees. They're paying for it in a number of different ways. And I don't think that connection's ever made. One of the reasons that healthcare costs rose so fast over the last decade or two for businesses is because the care for the unemployed, uninsured, underinsured, the general trend of cuts in payments for Medicaid and Medicare, those costs were shifted to the places where providers could get paid, and generally that was business and industry.
In Greensboro, Cone Health recently, and I'll use this term, broke cover, and is really the first hospital system to file for a healthcare license to sell health insurance to their constituents, to new clients, whatever. Michael, does this open up a brand new competitive front between hospitals, healthcare systems, and insurers?
Well, it can, yes, certainly.
And will you do this? Will you consider this?
Yeah, it's not. They're the first in North Carolina. Although there are licenses on file with the Insurance Commission in North Carolina, owned by providers, to do the same thing. They've just never been acted upon. So Cone's plan is to do this. There's a big system in Southern Virginia, in the Tidewater, Virginia, named Centera. They've been doing this for years. Actually, Forsyth used to have an insurance product. They sold it. So it's not brand new, but it is. It's something I think you'll see more of. I think you'll see sort of a staggered, iterative process of providers trying to figure out how to get in the risk game that the insurance companies are in now. And this is Cone's way to do that. You'll also see, and have already seen, bundled payments. You'll see some of the things that we're doing in this market in terms of branded products with insurance companies is more of a collaborative thing. So it's all aimed in the same direction.
Thank you. Thanks for being on the program. Of course, we just scratched the surface and didn't get to a half a dozen things that you may be glad we didn't or did, but thank you for being on the program.
I'm happy to be.
Good to have you here.
Anytime.
Frank, thank you for coming up from Charleston as always.
Thank you.
And Linda, thanks for making it in from the Triangle during the lack of bad weather that we thought was coming. But
That's right. Thank you.
Until next week, I'm Chris William. Good night.
Major funding for Carolina Business Review was provided by the Duke Endowment, a private foundation enriching communities in the Carolinas through higher education, healthcare, rural churches, and children's services. Blue Cross and Blue Shield of North Carolina. Who's responsible for rising healthcare costs? Join us and many others in a candid discussion at letstalkcost.com. Grant Thornton, operating in more than 100 countries, our tax, audit, and advisory professionals specialize in helping companies unlock their growth potential. Novant Health, bringing you world-class technology, clinicians, and care when and where you need it. Sunoco, a global manufacturer of consumer and industrial packaging products and provider of packaging services, with more than 300 operations in 35 countries. Blue Cross and Blue Shield of South Carolina, where healthcare is changing for the better. Find out how at ahealthysc.tv. And by viewers like you. Thank you. Promotional consideration provided by Business North Carolina Magazine. For more information, visit carolinabusinessreview.org.